Hey everybody, I'm Bones Calhoun. This is Johnny Rottenseed. We are coming to you today with this video, which is going to be family oriented. We realize that a lot of our videos that we do and the way that we speak does not really speak to everyone. So we're going to discuss some things that are PG and for everybody. Today we're going to kind of talk about what our channel's about, which is recovery, and the things that you need to do to maintain that. We're going to spit a little bit of facts for you. Johnny Rottenseed's going to. So I'm going to turn it over to him and kind of let him explain some things and kind of what we're doing here.
All right, guys, as Bones said, I'm Johnny, and we do videos that are oriented more towards people who are early in recovery, people who may have just got out of jail or prison, people in treatment. So we speak how they speak in a lot of our other videos, because that's the audience that we're truly trying to capture. However, we've had a lot of people reach out to us that wanted to share our videos with family members, with Christian groups. However, the way that we talk in those videos weren't really oriented in that manner. So, because we had that request, we decided we were going to do some videos along that line. These videos will be titled For the Family. It'll be a series, so anytime you see For the Family 1, For the Family 2, that will be these more PG videos, so you can show to your family members, you can show to the Christian groups, and all that type of stuff. We're getting requests to do these things. That's good news for you guys. The reason why is because that means your family member or your loved one is actually watching videos of us on YouTube discussing recovery. They're not watching the latest Lexi Pantera twerking video. They're actually trying to do something that might help them. So that's good news for you. As far as it goes, he was talking about I was going to break down a few things. So in a previous video, I broke down the very heated debate that's come with addiction, recovery, and choice and disease. And whenever I broke that down, I said if you believed that it was a choice or if you believed that it was a disease, that you were actually wrong if you believed either of those two things. And the reason why is because one, an addict chooses to use a substance the very first time. This is true. Even if they were doctor prescribed or something like that, there's a good chance the person knew that it had addictive qualities, addictive natures, and that if they took it, there was a chance that they could get addicted. So yes, the first time always that an addict uses a substance, it's choice. However, the period of time that happens after that, when an addict loses control and the mental obsession kicks in, the choice is no longer there. They have to use in order to feel normal. That's not a choice. Getting to the point of living in a gutter, living homeless, putting a needle in someone's arm, nobody wants that for themselves, so that's not a choice. When it comes to a disease, the breakdown, right? Disease. We're going to break the word down grammatically. Dis-ease. Dis means away from or out of. Ease means comfort. So, if we look at the two words separately, dis, out of, or away from, comfort. Anyone who's had a disease will probably tell you that it's uncomfortable, right? It's away from comfort. A person who's in active addiction, this presents itself in a way that sounds like a disease. It's obviously not comfortable to be living homeless or in treatment or in jail or using substances through a needle or anything like that. None of that sounds comfortable, so it definitely does sound like a disease. With the disease, things have to be chronic, progressive, and fatal. Those are the three qualifiers for a disease. Again, however, this is not a disease. Although addiction does present itself in three things. Chronic, meaning it's always there. You never get rid of it. Progressive, it always gets worse, it never gets better left untreated. Fatal, obviously addiction kills people, right? So it sounds like a disease. That's why that moniker's kind of happened. However, here's the truth. It's a disorder. Disorder means of the mind, right? So when we talk about mental health issues, we call them disorders. Let's break that word down. Disorder, away from or out of, disorder. We all know what order is. Structure, in line, appropriate, right? Out of order. Any addict in active addiction, brain is definitely out of order. If you've been around many addicts, you'll understand that. Their thinking isn't right. They don't make proper decisions. So, disorder, out of order. When we're talking about disorder, it's always with the mind. Anything as far as mental health is a disorder. It's bipolar disorder. It's chronic depression disorder. Substance use disorder. That's what we're talking about whenever we talk about addiction. Substance use disorder. Out of order. Now, this goes back to the AMA in 1956 recognized alcoholism and addiction to other substances as a disease. However, it's changed. Throughout times, they started to realize that things that happened in someone with mental health was a bit different than something that was going on physically with the body. Physically with the body means disease. We're talking about cancers. We're talking about, diabetes, anything that has to do with the body, that's a disease. When we're talking about with the mind, we're talking about a disorder. Now we use what's called a DSM. Today's is a DSM-5. Now, that's how we basically diagnose whatever's going on with someone. So, whenever we get someone in and we're discussing with them their life, their lifestyle, their choices, and all those things, as we build that assessment, then we're able to give a diagnosis. And when we're talking about substance use, it's a disorder. So, you have moderate or severe alcohol use disorder. You have mild, moderate, severe opioid use disorder. Always a disorder, because when we're talking about addiction, we're talking about of the mind. So that's just the easiest way that I found to break it down for other people. Also, I want to clarify something. If you're dealing with someone who does not believe that it's a choice, or who does not believe that it's a disorder, that it's a choice, it does no good to argue with that person. They're still mad because an addict stole their weed eater out of their shed 6 years ago. And they're not willing to listen, and it's an argument not worth having. So please, don't get in comment sections on whatever Facebook group you're on and argue with whoever about it being a disease, or, try to debate with them and convince them that it's a disease and they're wrong because they believe it's a choice. It's doing no one any good except for wasting a whole lot of time. What you can do is educate yourself. The most important thing I let people know is all major medical organizations throughout the world recognize substance use as a disorder. There is no debating that. If they believe that they know more than the major health community, then that's their problem. That's their fault. And they are not willing to listen to what medical professionals have to say. So why do you think they're going to listen to you while you're arguing with them in the comment box? It's not doing anyone any good. You're wasting your valuable time. Find something better to do with it. Get with your loved ones. If you have an addict in your family, call them and check on them. Do something like that. Don't waste your time in the comment box trying to argue this fact or that fact. Social media has been a great thing in putting people in contact with each other. However, it's become a serious issue that people think that their opinions are valid and important. And just going to be real with you, mine included, most of the time our opinions aren't worth much. So don't argue with people about the stupid stuff. Just give them the facts, and if they don't want to listen, just move on with yourself. Bones, you got anything to say about that?
Yeah, I want to say, if you're watching this video and you have a loved one that is actively in addiction, understand that they may be genetically predisposed, man. They just might, they might not be the type of person that can pick up a beer, drink it, and put it down and never touch a beer again. That lifestyle of active addiction is not fun. Once you are an addict, It's simply to maintain not feeling horrible. Active addicts, we don't go out and steal stuff and hurt our loved ones because we want to, because that's what we set out to do that day, is specifically to hurt you. It's because we have to feel better. We have to feel, like he said, it's a mental obsession. It takes over your mind. And, if you were laying there in the woods and you had a broke leg, and, somebody come up to you and was like, hey, you can either crawl out of these woods right now by yourself and suffer, or I'll go ahead and give you this and you can feel better. I mean, what are you going to do? Like, you're going to want to feel better. But there's treatment out there. There's options. There's science behind it. Some people are just willfully ignorant to the science, even though it's out there for everyone to see. So just understand that if your family member is actively an addict, try to be patient. Try to learn why they are the way that they are, and just get them help. There's resources out there. We both work in recovery, man. Like, message one of us. We'll help any way that we can. We're doing this simply because we care. We're not making these videos for the families or our other videos because we want attention or anything like that. We simply care about you all. So as far as that goes, that's all I got to say. Just keep everything we said in mind and really try to take it in.
You guys remember, it's a disorder, not a disease. It's not a choice. It's a disorder. That means of the mind. It means we're dealing with a mental issue. But the great thing about this is there is treatment. As Bones was saying, both of us work in the treatment field. If you know someone, or if you yourself are out there, if you're actively using, someone who's actively using, somebody who needs help, feel free to contact either of us. You can find us in the comment box on YouTube where this video is posted. You can find our page on Facebook. It's Dark Side of the Spoon. You can message me. I'm Johnny Rottenseed on Facebook. Look that name up. Bones, Justin Smith, parentheses, Bones Calhoun. You guys can find us. Find us. Send us a message. We'll do everything that we can to get you help. We have a lot of resources between the two of us. We've got a lot of contacts, and we can probably make something happen for you. Family members, guys, you probably have it worse than the addict. I'm just going to be real honest with you. See, the addict does all the stuff, and they also get the relief of the drug use. Families, you get all the mess, and you don't get the relief of the drug. So your guys' job is probably harder than the addict's is. And it's hard to love someone and watch them basically on a destructive path to their death. And we understand that. I've loved someone who's in active addiction as well, and I understand how hard it can be to love somebody in that manner. But you guys are the rock in that person's life. You're the person who, when everything comes crashing down, you're going to be who they call. This is your time when they're at their very bottom to say, hey, I know a couple guys that might be able to get you some help, and put them in contact with us, or put them in contact with whatever other resources you have in your area. By all means, we are not the only thing going on, and we understand that. As Bones said, we're not doing this for any type of recognition. We're just trying to get out here, talk about the real stuff that's going on with addiction, try to allow people to understand that there are people out here trying to tell the truth about what's going on. We're not trying to coddle or baby. We're just trying to give you the real, raw, this is what it is. So feel free, as I said, to contact us, contact your local resources if you need to, but try to get some people some help. By all means, it usually takes an addict to be at his end before he'll be ready to change, or she. But that doesn't mean that we turn our backs completely. If they are in active addiction, if they aren't changing, don't even give them a sandwich. I know that sounds harsh, but don't enable. Don't give them a sandwich. Don't give them a place to sleep. Help them find their bottom. Love them to life instead of loving them to death. And if you're enabling them, you're loving them to death. We appreciate all the support we've gotten thus far. Our Facebook page has really taken off. Our videos have done really well, and we've appreciated everybody who's shared and supported us in every way. With this, the Christian groups, the family members, all you guys, as I said, the video section that this will be under will be called For the Families. Please like, share, subscribe to all this stuff. We will be bringing more content. We just wanted to kind of introduce ourselves so you guys would understand and give you guys a little breakdown of what we're dealing with when we're talking about addiction. As far as everything goes, that's all I got to say. You got any last words, Bums?
I just got one more thing I want to put out there, because this is something that I've gotten several, multiple messages over, and it is family members, not the addict. And these family members are tore up and they don't understand why they can't change that person. Listen to me. You cannot change that person. They have to want that change. They have to want the change in their life as much as they want air in their lungs, because until they want that enough, the change is not going to happen. You are not going to make your family member change. That is an act of addiction. So understand that. And it's hard, I know, but try not to lose sleep over the fact that everything you say is going in one ear and out the other to this person, because their mind's clouded, man. It's an obsession. So just know that. So don't get tore up and upset because your family member's not changing. They have to want it. If they don't want it, there's nothing you can do. So don't lose sleep over it. And like he said, do not enable. That is the worst thing you could possibly do, because not only do they use drugs, but they use you. We're users, man. So when we're actively in addiction, we're going to tell you what we want you to hear. We're going to tell you we want change when all we want you to do is go upstairs so we can get in your purse and get money. I mean, they got to want it. So know that. That's all I got, man. I appreciate you all.
Guys, like, share, subscribe. We appreciate the support. You guys have been really awesome to us. We appreciate everything. Don't forget, disorder, not a disease and not a choice. We appreciate your time.